Good morning, everyone. Welcome to our monthly educational webinar. Today, the topic of today's webinar is about oral health. We'll invite our guest speaker to share us about practical tips for everyday dental oral care. So before the webinar, there are some housekeeping rules. As usual, the session will be recorded. So
Angela,
please, okay, as usual, the session will be recorded. So please make sure you refrain from recording or taking photo of this session to respect everyone's, privacy. After the presentation, you will receive a copy of the slides. You will be muted during the presentation. If you have questions, you can write or type in your question in the chat box. Then we will answer your questions during our question and answer time. During the QA time, it is up to you to have your camera on or not. But we do encourage, it is a very good opportunity for everyone. We can see each other's faces for well-being, of everyone. And we're happy to see others' faces. Today's session is co-hosted by three organizations. We have Shikaki from Momiji Healthcare Society, and we also have Japanese social service, the Rumiko. She is a volunteer and program coordinator. And me represent Johan Center for Geriatric Care. So today's presenter of our workshop is Mr. Howard Ma. So he is a co-owner and dental hygienist from ALH Dental Hygiene Clinic.
and today's interpreter is Nico Matsuzaki. It's our first time having her join us. Please join me in welcoming her. それでは今日のセミナーを始めていただきたいと思います。Okay, let's get started today's seminar. Please share or let me put down your.
Perfect. So let's get started. So good afternoon, everyone. Thank you all for having me here today. It is my honor to speak to you about dental health for seniors. So as we age, people tend to focus more on their health, and our oral health should be no different. I hope today's presentation helps strengthen everyone's understanding of oral health and how it relates to our overall health. Okay, so to introduce myself, my name is Howard, and I've been a registered dental hygienist in Ontario for the past 14 years. I'm one of the owners of ALH Dental Hygiene Clinic beside Markham Stouffville Hospital, as well as the CEO of the Chinese Dental Hygienists Association of Ontario. I also work part-time as a dental hygiene clinical instructor at Oxford College. And during my career, I've worked in multiple clinics across the GTA to deliver professional services and advice to the clients that I serve to improve everyone's oral and overall health. Okay, so in today's presentation, these are some of the topics that we will be going over. So firstly, we'll talk about our gum health and how that relates to our overall health. Secondly, we'll talk about smoking and the effects that it has on our oral health. We'll also be talking about some basic and regular home care routine, as well as how to care for our dentures, our implants, and our prosthodontics. We'll also be discussing regular dental cleaning interval recommendation, as well as some of the general misconceptions of dental cleaning And at the very end, there will be a Q&A session for me to answer any of your questions. All right. So when it comes to oral health, let's talk about two of the most common diseases. Firstly, we have gingivitis, which is a reversible inflammation of the gum tissues caused by plaque and bacterial accumulation. So as we see on this diagram, on the left, we have healthy gums and healthy tooth. That's free of any plaque and bacteria accumulation. So in this case, the gum will appear pink in color. So on the right side here, though, we see that with plaque and bacterial accumulation, the gum tissues nearby becomes more inflamed and red in color. And as we see in this real life picture here, the gums around the tooth now becomes very inflamed and very red. It will very likely bleed more easily when being touched. So oftentimes bleeding is just a sign that the gums are not as healthy as it should be. Okay, so if gingivitis were left untreated, the disease can progress into a irreversible form of the disease known as periodontitis. So with periodontitis, it doesn't just affect the gums, but it also destroys the bone and supporting tissues around the tooth. This creates a deeper space between the gums and the tooth, known as a pocket. And the end result of periodontitis can include dental and gingival pain, tooth mobility, and premature loss of dentition. So the diagram on the bottom here illustrates this process very clearly. So on the very left, we have healthy gums and healthy tooth. And with some plaque accumulation here, the surrounding gums becomes inflamed, and that's how we get our gingivitis. If this condition were left untreated, so now the gums become even more red and swollen, the bone and supporting structure nearby becomes more inflamed and destroyed, and there is deeper pockets. So that's what we call periodontitis. And if this condition is still being left behind or untreated, ultimately we have advanced periodontitis, which is characterized by extreme loss of bone and supporting structure around the tooth. So the tooth now becomes less and less supported, and eventually it may fall out completely. Okay, so now that we have a basic understanding of gum disease, let's discuss the link it has with our overall health. So for diabetes and gum disease, they have a strong two-way relationship in that they each make one another's conditions worse. So diabetes causes elevated blood pressure, which feeds the bacteria in our mouth that leads to plaque formation and infection. It also impairs healing and reduces our salivary flow, both of which weaken our gums' ability to fight against the bacteria. So gum disease, on the other hand, though, also raises blood sugar in our blood level, making it harder to manage the diabetes. So as you could see, having both diseases together really is not a good sign because they do tend to make one another worse. So for heart disease and gum disease, the bacteria that causes gingivitis and periodontitis can travel through the bloodstream to trigger chronic persistent inflammation. This can lead to increased risk of blood clot in arteries and also a higher chance of cardiovascular disease. As for lung disease, The harmful bacteria in our mouth that are associated with gum disease can be inhaled into our respiratory system, causing increased risk of pneumonia, chronic obstructive pulmonary disorder, and bronchitis. And for pregnant women, maintaining good oral health is crucial for a healthy pregnancy. During pregnancy, the hormonal changes create an increase in oral bacteria presence and gingival inflammation. This is known as pregnancy gingivitis. If the condition is not well managed, the bacteria can affect both the baby and the mother. So some of the adverse effects include premature birth, low birth weight, and a pregnancy-induced high blood pressure, which can be a lethal condition. So now let's shift gear a bit and talk about smoking and oral health. Smoking is a very common habit for a lot of people. And while it is within someone's right to smoke, there are certainly huge health risks involved. Orally, smoking is a major risk factor for gum disease. Smokers are 85% more likely to develop gum disease compared to other non-smokers. Some of the common dental side effects of smoking include loss of teeth, dental cavities, stained tooth, bad breath, and dry mouth. Not to mention, smoking is also strongly correlated to the development of oral cancer. So this picture down here is is an illustration of what our teeth might look like for someone who smokes. So all the nicotine stains will stain our teeth with this tobacco stain. Okay, since we mentioned about oral cancer, so this is a simple in-home self-assessment for oral cancer that we could all do for ourselves, regardless if you're a smoker or not. So the diagram shows some of the areas that we should be looking for signs of abnormal bumps, patches, or signs of irregularity. So if we follow the diagram, this is the lip area underneath our lip on the front tooth. So you want to pull up your cheek and your lip, and you wanted to observe this area for any abnormal bumps or patches or coloring. You want to check the lip itself to make sure nothing abnormal is growing on the lip. This is the side of the cheek inside, beside the tooth. This is the lower lip around our bottom teeth here. Again, you want to pull the cheek back, and so you want to pull the lip back and observe this area for any abnormal growth or any patches or anything that doesn't look right. Your palatal area on the top of the mouth, the throat area, the tonsils, the soft palate. This is underneath the tongue, and this is on the side of the tongue, and also to remember to check on top of the tongue itself. So these are some of the common areas that we should be looking for any form of abnormal growth or signs. So the idea of this home assessment is not for you to diagnose the oral cancer, but rather it's a sign to seek professional help if you discover any form of abnormalities in the mouth. Okay, so to maintain good oral health, the most important task is to follow a good oral hygiene routine. Let's reinforce some of these knowledges. It is recommended to brush 2 to 3 times a day for 2 minutes each time. You could use either a manual or electric toothbrush. Current research suggests brushing with a soft bristle brush using gentle strokes. This is especially important for electric brush users. Be wary of not putting any extra pressure when you brush, we should simply let the brush head do the work for you. So brushing with a fluoridated toothpaste is highly recommended. There are definitely many different toothpaste options on the market. While everyone's condition might call for a different product, using a fluoridated toothpaste is the main message here. And it is also recommended to floss once a day at nighttime before you brush. This is the one oral habit that is still lagging behind for many people. So a lack of flossing can mean bacteria and plaque in between the teeth are not being removed properly. This would explain why, for some people, that they may continue to get cavities or gum disease despite very good brushing. There are many different, again, there are many different types of floss, traditional floss, dental picks, and interdental brushes, etc. We will definitely be talking more about these products in the upcoming slides. So this is a simple demonstration on how to floss. So in this slide here, you want to hold your floss tight and you want to slide the floss in between the teeth. So once it's in, it's very, very important that you feel the floss hug around the tooth. So it is these surfaces in between the teeth that you really want to feel the floss hugging because that's where all the food and bacteria accumulate. So it's these surfaces where you really want to clean. So with the floss hugging the tooth, you move it up and down on both sides of the tooth. And here you want to go down as far as you can without hurting the gums. And you want to feel the floss go into that space between the gum and the tooth. This is how we effectively clean underneath our gum to remove all the plaque and bacteria. So for people who have a difficult time with traditional floss, the interdental brush is one good alternative. It's a small pointy brush head that allows it to thread in between the tooth for interdental cleaning. So again, there might be many different options and products in the market. Regardless of which one you choose, as long as you could get the head in between the teeth to clean interdentally, then that's the most important factor. So another alternative for flossing is the water floss. So in this picture here, so this unit here, there's a water reservoir that gets filled in with water. And a moving handpiece here, you could take in and out. So from this handpiece, there will be a jet of water that shoots out to clean the desired area around the tooth. So this is good for cleaning in between the teeth, and it's also ideal for people with braces, implants, or dental bridges. It is very important to clean our tongue as well after we floss and brush. Bacteria can accumulate on our tongue, and cleaning it regularly is very necessary. So here we could see there are special tongue cleaners that we could use to clean our tongue, or we could also brush our tongue with our toothbrush after we finish brushing our teeth. Okay, so amongst the senior population, it is very common to have denture, crown, bridge, or implant in the mouth. And we'll talk a little bit about their home care method. So here in this picture, I'll talk a little bit about what each of these are. So a denture is a removable appliance that you could take in and out of your mouth to replace some of your missing teeth. A crown here is like a little helmet for a tooth. So sometimes when a tooth is very heavily restored or filled, we may need to replace a crown in order to protect that tooth. So here we have a bridge in the implant. So a bridge is a series of lab fabricated crowns that are connected together. This entire unit can be used to replace area of a missing tooth. So for example, here we have a missing tooth here. So we could use the tooth beside it, prepare the tooth by shaving it down a little bit, and this entire bridge unit here will be glued onto these two real teeth here. And that can be used to replace this missing tooth area right here. For the implant, now there are two components to an implant. The root implant portion itself, which is surgically inserted into our bone. After some time, after the bone has healed up and integrated with the implant, the crown portion will then be installed after. And this is to replace your missing tooth. This is becoming a very, very common option nowadays because scientists and research believe that this option behaves most like your actual tooth. Okay, so for our removable dentures, they could be taken on and off anytime. Dentures, though, should be removed before one sleep. It should be brushed thoroughly, just like how we brush our actual tooth. And it should be soaked in water or inside a cleaning solution using cleaning tablets or products such as Polident. So previously, we have already mentioned water floss as a good option to clean around implant, crowns, and bridges. Another option to clean around these area is the super floss here or the floss threader. So what this is, the super floss, it's a long strand of floss with a stiff end on the one side. The stiff end will allow you to get underneath these areas to allow you to effectively clean underneath and around these areas. With the floss threader, sometimes you may not have the super floss. So what you need to do is if you have the traditional floss, you could thread that underneath around this loop here, and you could thread the entire threader with the floss wrapped around it underneath these areas of implant, bridges, and crown to allow you to clean around the area. Alternatively, if you have the water floss, you could just simply use the water floss and aim it around the implant or the bridge, the crown area, and you could choose to clean the area this way as well. So while good oral hygiene is the most important component to good oral health, it should be supplemented by regular visit to your dentist for professional cleanings and regular checkup. Having regular dental cleaning helps with prevention and reduces progression of periodontal disease. So for most healthy adults, dental cleaning would be recommended every 6 months. For individuals with more moderate to severe stages of gum disease, more frequent cleaning every 3 to 4 months may be advised. And I would highly encourage everyone to see your dental professional regularly for individualized treatment plan and home care recommendation. Now that we know the benefits of having regular dental cleanings, let's talk about some of the general misconceptions of dental cleanings that are out there. So, firstly, dental cleanings is harmful for the tooth. It damages the outer surfaces and structure of our teeth. So to that, I say this is false because our tooth is an incredibly hard structure. And with proper and regular professional cleaning will not cause any damage to its surfaces or structure. Secondly, the second misconception is that dental cleanings can make my teeth permanently more sensitive than before. And well, this might be true temporarily. There may be temporary discomfort during and after the procedure, but dental cleaning itself doesn't directly make her teeth more sensitive permanently. And lastly, dental cleanings can make the gaps between my teeth bigger. So this picture down here illustrates this point perfectly. So gaps between our teeth may appear bigger after cleaning because hard plaque that used to occupy the spaces between the teeth are being removed. So here we could see this is someone who probably hasn't had a cleaning in a long time. So the presence of all these hard plaque is essentially occupying all the spaces that were always there in between the teeth. So now, after all these hard plaque were removed, now the original spaces that were here all of a sudden shows up. So this is why a lot of people feel that after the dental cleaning, the gaps between their teeth appear to be bigger. But this is the reason why. It's not that the cleaning itself created the space, it's that they were always there. We were simply just removing all the extra stuff that used to occupy these spaces that weren't supposed to be there. Okay, so that concludes the end of my presentation. I thank you for your time and interest in learning about this topic. If anybody has any questions, I'm happy to answer them for you. Thank you.